My name is Kamaria Kaalund. I am a doctoral candidate in the Department of Health Policy and Management.
What motivated you to focus on these research areas?
I would say there's a mix of professional curiosity and then personal experience. So I'm from North Carolina, and one of my earliest introductions to public health was when I was around 9 or 10. I was with my mom, and she was doing some work in eastern North Carolina in a really small county called Pender County, which had experienced a lot of devastation following Hurricane Floyd in 1999, which was a really devastating hurricane that hit a predominantly black neighborhood that sits because of redlining in a massive floodplain. And we were there doing community health assessments, trying to understand some of the problems that the community was facing related to chronic disease.
What is your dissertation about?
My dissertation examines the impacts of hurricanes on rural hospitals, access to care, and patient outcomes with the goal of identifying policies and health system characteristics that promote resilience.
Can you give us an overview of your career thus far?
Yes, so I feel like I've gone on an interesting journey. I did my undergrad at Wellesley College, and I was a neuroscience major and an anthropology minor. I didn't really find my way to public health until my senior year of undergrad. And then I also graduated during the 2020 COVID pandemic, and public health was a big topic of conversation. And so I was looking at jobs when I graduated in a wide array of things, but I ended up getting a research position at the Duke-Margolis Center for Health Policy, and that really introduced me to health policy. I did a lot of community-based care delivery work related to COVID while I was at Duke, and then I really solidified my interest in doing my doctoral studies after that experience.
What led you to doing your research here at the Bloomberg School?
So I was really drawn to doing my research here at Bloomberg because my interests really lie at the intersection of health policy, epidemiology, environmental health, and health services research. And the Bloomberg School is a really great place to be in that environment where the disciplines are very collaborative. And then another factor is this really great balance of rigorous methodology and the methodological training that you get at Bloomberg, also paired with this focus on translation of research into policy and practice.
How have you liked Baltimore?
I've loved Baltimore. I think I loved it way more than I expected, and I'm from a small rural town, so this is a big city to me, even though it's definitely not the biggest city, but I love Baltimore. I've enjoyed I live in Butchers Hill. I've enjoyed being near the park. I've enjoyed the community in Baltimore, all the quirky events that happen. This is a really art-focused city, which has been really fun to experience, and the food is great.
What impact do you hope your research will have?
I hope that my research will help policymakers, particularly in rural areas and among rural health systems, identify strategies and ways to build resilience as climate disasters become more frequent and severe, and thinking about how we can really strengthen and support rural health system and healthcare delivery.
What have you learned so far during your research on rural hospitals?
One thing that I've learned specific to my dissertation work, I would say, is that outside of just the impact of the hurricane storm itself, what really matters more is how resilient hospitals are and the larger healthcare ecosystem is to respond to the crisis, and then the aftermath of the crisis is more of the question than how devastating the storm has been.
What do you like to do to decompress?
I really like to play soccer with friends here at school. I joined the Baltimore Volo team for soccer, which has been really fun. I enjoy walking in Patterson Park, getting Be More Licks, and also just anytime I can be by the water.
Like right now?
Yeah, exactly.
Since you've been playing soccer, have you been watching any of the World Cup games?
I have. I've been really enjoying the World Cup. It's been really interesting to see how the city really comes alive when there's like a shared interest, and I've been enjoying like going to local bars and watching with friends. Yeah.
Do you have any book recommendations?
I don't have a book recommendation, but I do have a short essay recommendation. It's a short essay by Octavia Butler called Rules for Predicting the Future, and it was published 26 years ago, but I think it's incredibly timely.
What advice do you have for prospective PhD students?
Yeah, that's a great question. I would tell those considering a PhD in public health or really for any program that it's important to have a clear understanding of your values and how you want them to be expressed in the work you do. I learned this from Jessica Harrington, who is a leadership development and training practitioner, and she led a workshop with PhD students here in the Department of Health Policy Management that was really informative to me. I think that understanding your values is not something that you really learn in your just regular doctoral programming, but it requires a lot of self-reflection and some kind of independent development. But I think for a career in public health, you really need that North Star to ground you. And while the methods and the publications and the number of projects you're on is really important, they're all very necessary, but they're not sufficient if you don't know what your values are.